Good afternoon, everyone. I am Dr. Ahmed Ali from GEMS College. I am going to present a case report of Lauren Moon BARDET BIEDL syndrome. Introduction: it is a rare celiopathic pleiotropic autosomal recessive disease with prevalence of 1 in 1,50,000. Primarily affects the offsprings of consanguineous unions, with most commonly presented with night blindness. Presence of 4 primary features with 2 secondary features are the clinical grounds for making a diagnosis. The primary features are rod cone dystrophy, polydactyly, obesity, learning disabilities, hypogonadism in males, and renal anomalies. The secondary features are speech disorders, brachydactyly, developmental delay, polyuria, polydipsia, ataxia, poor coordination or clumsiness, diabetes, left ventricular hypertrophy, and hepatic fibrosis with spasticity and hearing loss. Case report: a 20-year-old male presented to ophthalmology OPD at GEMS Hospital with complaints of night blindness since childhood. Parents have given history of delay in milestones for verbal and motor. Similar complaints were seen in his elder sister. On examination, patient is conscious, coherent, and cooperative. Truncal obesity with short stature is seen, and on systemic examination, there is polydactyly seen in left foot. The central nervous system examination revealed low intellectual quotient, and a GCS score of 13/15 was observed. He has normal high mental functions and intact gag and cranial reflex. The patient was unable to button his clothes, which is a marker of cerebral defect. Muscle bulk and tone are normal in all the limbs with regard to power and reflexes, and both lower limbs showed a power grading of 4/5. Plantar reflexes are bilaterally reduced. On genital examination, revealed a micropenis of approximately 2.5 centimeters, smaller than the regular scrotum of approximately 2.2 centimeters, with intact testis of pubic and axillary hair. Local examination, head posture is normal, facial symmetry is normal, in extraocular movements are full and free in all directions. Both eyes uncorrected visual acuity was 6/18 with correction BCVA is 6/9. On slit lamp examination, anterior segment is within normal limits. Fundus examination, media is clear in both the eyes. Optic disc is waxy and pale. Mild arterial attenuation with jet black pigmented bony spicules of mid periphery of the retina are seen, and the foveal reflex is dull. This is the picture depicting the retina, and here we can see the polydactyly and truncal obesity of the patient. The symptoms of clinical findings, family history, and imaging studies are suggestive of Lauren Moon BARDET BIEDL syndrome. Conclusion: Lauren Moon BARDET BIEDL syndrome is a disorder with an identified pentad of symptoms, which are obesity, hypogonadism, intellectual impairment, polydactyly, and retinitis pigmentosa associated with renal anomalies are the major cause of morbidity in these cases. Low vision aids help in visual rehabilitation. Genetic counseling of the affected families could not only warn them the possibility of having more children in future with the said condition, but also raise awareness about the need to get the other family members assessed for renal and cardiovascular problems.